Hi everyone, welcome to our talk from the SSC on the Republic of Ireland Reimbursement Scheme, previously known as the EU Cross Border Directive. Now, everyone calls it the Cross Border, so for tonight's purposes, we'll call it the Cross Border. I'm Fiona Roche, I'm the Business Development Manager here. I've been working with Northern Ireland, with Musgrave Park and Craigavon and the Cross Border Scheme for about 13 years now, so we have a lot of information about the different services in Northern Ireland and how you can contact them and get back into those things after surgery. So to talk tonight, I'm going to do the talk tonight on the presentation, and that's going to be followed by Gavin McHugh, and then there'll be a live Q&A, and Glenda Thorne from Finance is going to join us for that. But in the meantime, you'll see that there's some tabs below on your screen. Now, what we do need you to do is ask us some questions. We can see a lot of questions coming in already. Some of those questions we will have answered during the talks, but anything that it isn't, we will answer. If you've got anything very personal or you need a bit more information, there's another tab there, contact the team. You'll also see another tab about finances, if you want to inquire about prices. And then finally, you might want to download the form for the application, and there's a download form there. Now, also, I have a copy of the form with me. So I know there are some parts of that form that people often ask the same questions, and I'm happy to go through that in the live Q&A. So thank you for joining us again, and I'll now have my presentation. Hello, so I'm going to talk now about the Republic of Ireland Reimbursement Scheme, which was before known as the Cross Border Initiative Scheme, which is what some of you may know it as, and I think some people still call it that. So, so this is a picture of the hospital, as you can see there, and as I've said, we are very close to Dublin Airport, and there is underground parking there. So the Sports Surgery Clinic, we are one of the leading private orthopaedic hospitals in the country. We look after all joints and muscles, bones, etc. So from your hips, your knees, your back, your neck, your foot and hand, we cover all those surgeries. The thing I think most people are interested in is the hip and knee replacement. So we do replace those. We do shoulder replacements as well. And we do some ankle replacements, but not as much. Now, the other surgery you may be interested in is the spinal surgery. Now, we do fusions here, but a lot of consultants don't tend to do them on the cross border. But if that's what you are looking for, do come to me separately and talk about that. But we do decompression of the spine and discectomy, and then most hand, foot and shoulder surgeries. So as I said, we're very close to Dublin Airport, and there is parking here. Now, this is about the scheme, and this is what a lot of people want to know about, is how do they get onto the scheme? Where do they apply to? Now, the one thing to apply for the scheme and to be eligible for the scheme is that you are on a waiting list, an NHS waiting list, and you will need proof of that when you put in your application form. So you will be able to get proof of that from your GP or from the consultant or the hospital that you are on the waiting list with. Now, a lot of people think sometimes that they're on a waiting list and then realize they're only on a waiting list so far to see a consultant, and they haven't actually seen a surgeon yet. If that is the case, and you're still having to wait another year for that as well, it's something that we can talk about, ways that you may be able to find a way to get into the waiting list and to see a surgeon rather than waiting longer before the scheme ends. Now, as far as we're aware, the scheme is going to continue till July 2022. Once you have approval on this scheme, you do have 9 months to get your surgery done. So once the approval's in, you can take your time. So what I do say to people is, if you're not sure whether you're going to go on the scheme or not, just put the application form in, because you have 9 months to make up your mind. So we have the phone number there. It's all based in Belfast, and there's the email point. You can go onto their website and download their application form, or you can go onto our website. And as I said, there will be a tab there where you can also download the application form. Takes about 4 to 6 weeks to get approval, and I know they are very busy at the moment, so they are saying give them up to 6 weeks before you hear about approval. So how it works payment-wise is you pay it all up front before your surgery. Now, we don't take any money till the day or the week before your surgery. And then once the surgery is done and you're discharged, you get a receipt from us. You hand that in with an application form back into the Belfast office, and you get refunded in about 3 weeks after that. Now, surgery itself, we have a team here of people, and that team involves myself, Glenda Thorne, who's from the finance side, Rebecca Lenagh, and Margaret Cromwell, and all of us can talk you through your individual cases if needed, and we will supply the phone numbers. There will be another tab, and you can get the phone numbers from this talk. So included, because this is one of the things most people are concerned about, is the price. Included in the price is your hospital stay in a semi-private accommodation. And when I say semi-private, it's that there'll be 2 people in a room. Not always on your own in a room, but there's no more than 2 in a room. Includes your first appointment with the consultant surgeon who's going to operate on you, your pre-assessment, including a cardiac echo if you need it. It includes all your surgeon and anaesthetic fees, your pre and post-operative x-rays, your surgery and your hospital stay, and also 2 post-operative appointments following your surgery. Now, it also includes the COVID swab. So what we are saying to people, though, a lot of people are actually managing to get their swab done closer to home in Northern Ireland, because it does mean another journey down 3 days before surgery to get that swab. So if you do want to get the swab done closer to home, we will take that price off the initial cost. You just need to let Glenda know when you're paying. So what's not included? So any additional consultations with our specialists. So say you go into pre-assessment and they find you have a heart condition, or your bloods aren't right, you know, something's with your liver or your kidneys, you might need to see another consultant to get clearance. Now, if you have somebody at home or closer to you, or you have a consultant that you see all the time, we're happy for them to send a letter down to say that they're happy for you to go ahead with surgery. If it's you don't, and it's somebody here, we have a cardiologist here. Now he can do it sometimes of just a phone review, and that's fine. But you do have to pay an additional fee for those. Any investigation is not part of your normal pre-assessment appointment or to the whole procedure. For some people, it may be extra MRIs or CT scans. It's quite rare, but if you do, they're not included in that package price. Also, what's not included is a private room. If you did want a private room, there would be an extra fee, and Glenda would be able to give you that information. So the surgery itself. Now, a lot of people have heard about us. They may have a surgeon that they would like to go and see, that they've been recommended, and we're happy to pass on those details to that surgeon's secretary. If not, we're happy to help you make that choice. All our surgeons are specialists. They're all on the specialist register for orthopaedic surgery. Appointments and surgery can be complete between 6 to 8 weeks. I know that a lot of people, it's the other important thing is how long they have to wait. Now, some people would like to have their surgery in 4 months' time after Christmas, around the Christmas holidays, and that's fine as well. And you just let us know, or your surgeon know, and then we'll organise that around that time for you. To save you doing too much traveling, we do book all your appointments with your first appointment with your surgeon on the day of your pre-assessment, and that's much smoother for you. The only time you would really have to come back is if you had to see another consultant, or you were coming down for your COVID swab. Appointments can be made on receipt of you getting approval from the Republic of Ireland Reimbursement Scheme. Now, if the reimbursement scheme is going to take 4 to 6 weeks to get approval, you can pre-book an appointment to coincide with that, but you can't book surgery till you have approval. After surgery, now a lot of people ask how long will they be in for. So I would say if you're having a knee or a hip replacement, it's 2 to 3 nights. Depends on your surgeon, and it depends on how you're feeling as well. There are local hotels available if you have relatives. At this moment in time, we still have no visitors coming in. Now that could change, but at the moment we're still following COVID guidelines. So if you do have a relative that does want to stay, or you're coming very early in the morning and you want to book a hotel, we do have local hotels. Now the Crown Plaza and the Holiday Inn are our nearest hotel, but at the moment they're being used as quarantine, so they're not available, but they may be over the next few months. So we are using also the Carlton Hotel on the Dublin Road, which is 10 minutes away from here. Convalescence, if you need convalescence or any social care packages at home, once you go home, you are still entitled to those under the NHS, but you need to let us know, and try and let us know from the time you come into pre-assessment, just so we have time and we're aware of it. So that can be, you can't pre-book these things, but you can be aware and have everything in place. Physiotherapy, the same. You're entitled to your physiotherapy on discharge within the NHS as well. But for some people, especially knee replacements or ACLs, don't wait too long to get back into the system. If you find you're waiting longer than 10 days, book some private physio as well, just while you're waiting. So these are questions that people ask. Some people ask, do I need insurance? Or they've been told that they may need insurance. So there is no insurance that will cover this trip. So there is no health insurance that will just cover this trip, or travel insurance. What happens if there are complications? Now, if there are complications while you're here, and it's not related as such to your surgery, maybe a heart problem or a bowel problem, we would probably then have to admit you into one of the public hospitals. Now, that's happened about 2 or 3 times over 12 years. It's very rare, but we have a good relationship with the other hospitals, so we do have that option. Now, as well, people before were worried about whether they were covered on the European scheme, that they had the EI card which covered them. Now, because of Brexit, you don't anymore, but that there is a global card that would cover you if we admit you to another hospital. Readmission within 30 days, which is related to your surgery, that we don't charge anyone that has to come back. And again, it is so rare, but if it just for peace of mind that you do know there is no charge within 30 days. Now, there's just a picture of the hospital where it's situated, and how you can see how close we are to Dublin Airport there. Now, thank you for joining us tonight. And I will be here to answer questions with you live, and you will get all our phone numbers that you can have if you want to call us on any of these things. Thank you. Hi, welcome back. Now we're going to have Mr. Gavin McHugh. He's going to do a small talk. Gavin's one of our hip and knee specialists here. So he's just going to talk through hip and knee and mention some of the other procedures. But he does talk a lot about the bilateral. So if any of you still got some outstanding questions on that, he may answer them for you. But if not, I'll be back with Glenda to join you for the Q&A. Thank you.
Good evening, everyone. Gavin McHugh is my name. I'm a orthopaedic surgeon based in a sports surgery clinic in Dublin. Fiona has kindly asked me to say a few words on the cross-border initiative based on my perspective of it, I suppose. So my area of expertise is hip and knee, and within that there, I suppose I mainly do a lot of hip replacements, knee replacements, partial knee replacements, and then soft tissue knee work such as arthroscopies and cruciate ligament reconstructions. Within the clinic as well, we've a broad area of expertise that covers really all the subspecialties, including spine, upper limb, from the shoulder, elbow and hand, and obviously then foot and ankle as well. I think over the last few years that I've been here, I've really a huge part of my practice has grown into based on the cross-border initiative. I certainly have had dealt with a lot of happy customers from the north. From my point of view, really, I say to people that, and there's obviously people are coming down and they're a little bit skeptical over what exactly is involved. And I say to people, I haven't really seen any catches in the whole process. It actually has been quite streamless, and the they've done a lot of work in the cross-border office to really make it as easy for patients as possible. Now, from a sort of principal point of view, lots of people have issues with regards to moving away slightly from the NHS. And I completely understand that, but from my point of view, when I'm seeing patients who are in a really bad way and are looking at waiting lists that are potentially years and years long, I mean, I think ultimately you have to make a call that's right for yourself. And I say to people, if that means being selfish for once, well, so be it. I certainly don't have any problems with that. And we have a similar process here in terms of lots of patients end up going the other direction, and there are lots of waiting list things such as the treatment purchase fund that are going on all the time. And ultimately, I say to people, there has to be a safety net there for people, because this is another concern that patients have. And ultimately, the NHS is still responsible for your care. So if you're on a waiting list for a hip replacement, and I perform the hip replacement, if there's a problem in the few weeks after the surgery, I'll certainly deal with it. There's no issue with regards to that. If there's a problem down the line, your consultant up north is bound to still look after you, and the same works both ways here. So you can be rest assured that it's not something that you're going to be left behind on. And in terms of what you get, I mean, and I can quite safely say that the care you receive in the sports surgery clinic is state of the art and among the best in the world, I'm happy to say. There, as I said, there are no real catches in the care. And I say to everyone, this is something that I've really fought for over the years, in that the price that the clinic gave you for the job is the price you pay. And if there was any problems and you stay in another night or two in hospital, there's no issues with regards to that. You know, essentially what we want you doing well following your procedure. We want you going home safe. We want you going home pain controlled. And ultimately, as I say, doing well. So in terms of just say what I do in terms of the breakdown, the vast majority of patients that I see are either hip or knee replacements, I mean that really speaks for itself. Within a hip is a hip in many ways, in that by the time that people have developed a lot of pain, really the only option for them is a hip replacement. And there are various methods of putting this in and various different types of prostheses, but they're really on a par nowadays. In terms of knee replacements, there are slightly more options, in that I have particular interest in partial knee replacements rather than just full knee replacements. And quite often, lots of patients I'll see have been told that they needed a full knee replacement, and I end up offering them potentially a partial, which is advantages in terms of the recovery process and indeed the knee that they have afterwards down the road. And one other area that I've sort of really developed an area of interest in is potentially looking at having both joints done at the same time, as in either both hips together or both knees together. And this is something that potentially sounds quite daunting to patients initially, but obviously the huge advantage in it is getting everything over with one operation and one recovery process. And again, particularly when I'm seeing people who are really in quite a bad way, and plenty of them barely able to walk, I think it offers huge advantages in terms of getting the back on track again. Again, it's not going to be something for everyone, but pretty much every week I'll do one or two patients with both hips and the same potentially with both knees. And again, just back to the partial knee then, when it's obviously much easier to have both knees done if you're just getting partial knees done. I'm not going to lie to people and say that having both knees replaced at the same time is an easy thing to go through. It certainly isn't, but often it's a real case of grabbing the bull by the horns and just getting on with it and trying to get really your life back on track again. So really that's it from my point of view. As I say, it's pretty straightforward, the entire process. We've done a lot of work to try and make it as seamless as possible for people. We'll try to combine the pre-assessment, as in the medical check that you get on the same day as the consultation insofar as it's possible. And then really all it, apart from the surgery itself, which is usually for a hip or knee replacement, usually around 3 nights in hospital, and then all that will be involved is one post-operative check around the 6-week mark from me. And different consultants might vary slightly in that, but for me, that's the entire process. So as I say, it's as seamless as we can make it. And really that's it from my point of view. I'm happy to see everyone and have a look and certainly give my opinion. And I often laugh at people saying, you know, or doctors differ, patients suffer, and really that's not the truth. In many ways, it's very important that I see you beforehand and make sure that I'm happy with the choice of procedure that has been recommended for you, and we can certainly have a discussion in that regard. And I look forward to seeing many more patients. Thank you very much.
Hi, welcome back. And I have Glenda Thorne joining me now, and we'll answer your questions. Okay, so the first question is from Bernadette Gargan, and I'm just going to take that one. Glenda and I will share these between us. So Bernadette says, how long do you stay in hospital after hip surgery? Now, hip surgery is 2 to 3 nights. It does sometimes depend on your surgeon. If you did need to stay a bit longer, that will be covered as well. So, you know, if you weren't ready to go after 2 to 3 nights, then we won't make you go home. We'll make sure you can do the stairs. We'll make sure that you're fit enough to go home. But 2 to 3 nights is the average. Then Bernadette also asked, what happens after the operation? Do I attend my own doctor or hospital for updates? So all your post-operative reviews will be here back in the sports surgery clinic. You shouldn't really have to go back to the NHS or your own doctor for anything, only for you see your own doctor to have and it'd be the practice nurse to remove your stitches or your clips for wound review. If we were worried about your wound, we would bring you back here though for wound review. So they're the kind of things you have to go back for, and maybe some physiotherapy. But other than that, all reviews will be here. Jane has asked, do you have to be on the Northern Ireland waiting list for any specific length of time before you can be considered for the scheme? The answer is no, Jane. Once you're on the waiting list, you're entitled to apply for the scheme. So, because some people have only just gone on the waiting list and other people have been waiting, 3 years. So now I think then Jane again asked, how long does the whole process take from approval and if agreed waiting time for surgery? So at the moment, we are being told that approval is taking anything from 4 to 6 weeks. I think the norm is around 30 days, but they've been inundated with application forms recently. So I think allow them 6 weeks. From that time with us, you probably waiting at the moment 4 to 6 to 8 weeks for surgery. Now we're just about to go into probably one of our busier times for surgery. So it depends on the surgeon you pick as well, how many surgery dates he has here. Some have more than others, but we're happy to take those calls anyway, or send us an email and let us know. But normally you're looking probably at about 4 to 8 weeks. Now, Glenda, I think next one's for you there.
Okay, so John is asking on the needed 2 hip replacements, how much would I expect to pay? Now we have specific prices for each procedure. So there's a tab there, you can click on it, send a query, it'll come through to me and I can send you the prices for specific hip replacements. Now just to let you know, John, that we actually do bilateral hip replacements, so you can have your 2 hips done together or you can have them staged. And it'd be interesting to know that you will actually get, for one single hip replacement, you'll get 6,500 sterling back from the cross-border scheme.
And also, when Glenda sent you back that information, she actually tells you all about how you pay as well, don't you, Glenda? Because a lot of people ask, can they pay by credit card, etc., and that's often the question that comes up. So
yeah, so I mean, for payment is you can do a direct bank transfer, you can pay on our portal, you can ring me and pay over the phone, or you can bring a bank draft. It would have to be your bank draft. But the information that we actually send you has all the finance information on it.
And how soon can they pay before surgeries? Is it a week you like them to pay?
We normally, if they're paying direct to the bank, we would need payment in the bank about 5 working days beforehand, which just means there's no confusion on the morning. It will have hit our bank account. If you're paying by card, just ring me a couple of days beforehand. We just don't ask for payment on the morning of admission because it could delay the admission process. Because normally what you would have to do is you'd have to actually contact your bank and tell them that there's a big amount going out of your account. It's for an anti-fraud. So we don't want that in the morning of admission. You know, if you actually can't, you know, the money doesn't actually come from your card, and it just causes a lot of frustration, a lot of stress. So just to get the finance sorted, just give me a buzz beforehand and we can get it all sorted out.
Yeah, lovely. I think then the next one, Glenda, there, Diane.
So Diane O'Hare. So Diane, you don't actually say if your mum is actually on the NHS waiting list. In order to avail of cross-border funding, you do actually have to be on an NHS waiting list. So it looks like your x-rays and scans were done privately. So in answer to your question, if you're not actually on the NHS waiting list, you actually can't qualify for the cross-border scheme. So that would be the first thing to do. And we would recommend going to see a surgeon privately up north, because you'd be waiting a long time to see a surgeon publicly. But make sure it's a surgeon that can actually put you on the NHS waiting list.
And you can probably still use all those scans, etc. as well. You know, as long as you have copies of them all, make sure you have copies of all those scans and MRI. Sarah, I had an MRI X-ray completed 4 years ago for hip impingement, and now I've been waiting for 8 years for surgery. Those scans are outdated and are they no longer relevant? So normally, at least the X-rays, they'd want one. Now, they don't always need MRIs either. That's the other thing. And X-rays we always do on the day that you come in for your pre-assessment and to see the surgeon. So we would do an X-ray for you anyway. That would be included in the cost. The MRI isn't included in the cost, but you don't always need an MRI for a hip replacement anyway. So it'd be probably worth just making the appointment first and getting your X-ray done on the day, because you might not even need an MRI, and avoid any expense for you as well.
Okay, so Brian, again, hip replacement, the costs, if you click on the finance tab, it comes straight through to me and I can send you all the details, including the price. We do a package deal, and that will include your COVID test, initial consultation, your stay in sports surgery clinic, pre-assessment, your surgeon's fees, your anaesthetist fees, a post-op consultation and a review, and a post-op x-ray. So it's a very comprehensive package and includes everything. The only thing it wouldn't include is if during pre-assessment you needed to have a consultation with a cardiologist, which would be about 200 to 250 euro. That wouldn't be included in it. But other than that, everything else is included in that.
Okay. Right, Roisin, will Santry Clinic have all the up-to-date relevant information about me if I go this route of surgery? Now, we wouldn't automatically, Roisin, have any information on you at all. The only information we would have is the information you send us. So anything like if you have an extensive medical history or you're on a lot of medication, you just ask your GP, could actually do a printout for you of all of that, and you bring that on the day of your pre-assessment. But we won't have access to any of that information on here at all. And any access we'll have is anything you give us. Okay, Sarah, if I've not yet submitted the application, should I still go ahead and book a consultation with the surgeon to start the process? Sarah, I would say don't make any appointments until you've actually at least submitted the application form, because that could take 6 weeks. And then the problem is that you could have your appointments all made and you still haven't heard anything. Now, once you've submitted the application and it's been in a couple of weeks, you could make an appointment for about 5 weeks' time, because at that stage they should coincide. But you cannot have a surgery date that is booked that is before the approval date. They won't retrospectively approve any surgery at all.
Okay, so Dave McGill, yeah, we do the trapeziectomy. It would normally be a day case procedure. Again, click on the finance tab and we can send you the prices. That surgery would normally be a day case procedure, would normally be an overnight. But if you needed to stay overnight for medical reasons, you would be covered for that as well.
Okay. Gordon, is it possible to have consultant appointments in the north if the surgeon works in Republic of Ireland, Northern Ireland? No, it isn't, apparently, because they won't cover that. You could have the appointment in the north, but they won't cover that when they refund you. That's the only thing. They'll only refund you for appointments done outside of Northern Ireland. So most people do have all their appointments here, but I do know there are some of our consultants work in the north and the south. So, and I know some of them would see somebody in the north, but they will charge you on that day and you might not be able to claim that back. So it's just up to you whether you decide it's easy to see someone, but you still have to come back for your pre-assessment if you're having a hip done. So if you're coming back for a pre-assessment, you have to come down for the appointment anyway, and we do them on the same day. But I know if it's something like a shoulder or a foot and ankle, that you may not need a pre-assessment, so that's, you can talk to the consultant about that, but you might not get reimbursed just for that part of the package price. Okay, Gordon, what is included in the pre-assessment? Does it include x-ray and bloods? So the pre-assessment includes x-ray, includes your bloods, includes an ECG. If you need a cardiac echo, it's included as well. As we said, the only thing that's not included, any MRIs or any tests that you need that aren't related actually to your surgery, or that might be related to some external issue that's been found, like hematologist or cardiologist.
CT scan wouldn't be covered either.
Yeah, a lot of them these days do them by phone since COVID, so they are cheaper than they used to be if you're having to see them face to face. Okay. So are Laminectomies performed at the clinic, please? That's Monica. Monica, that's foot and ankle. Yes, they are. Joe is 100%. That's one for you, Glenda. There.
Normally, you would get between 40 and 60% back. You wouldn't get 100% back. Certainly for hips and knees, it's between 40 and 60%.
We were talking there about the foot and ankle, the shoulder and the hand surgeries, that they're very complicated sometimes, and there are lots of different surgeries. So what would help you when you're coming to price those surgeries for people?
Right, so well, especially the ankle and the shoulder procedures that are always done as multiple procedures. So to save time and to get a specific price, we would ask patients to send the referral into us. So once they get the referral sent into us, we then get it sent over to the surgeon, and then they can code it up. It's normally 2 or 3 procedures, definitely for the shoulders anyway. And then once we get the referral, we can give a specific price rather than approximate. And then the patients know exactly what surgeries they have.
Lovely. Thank you. Yeah, and our prices are all quoted in euros, aren't they? So
Euro, we don't accept sterling at all. We don't have a sterling account, so you would pay in euro.
RE post-op physio, most people do not need or get post-total knee replacement or total hip replacement outpatient physio in the NHS. Okay, so most people as well here, they do recommend, especially physio for our knee replacements. Now, the hip replacements don't always need physio, and they can do very well if without it. But we do recommend that the knee replacements do have physio, but if they're doing well with their exercises that they're given, then that you can assess it that way. But if you aren't and you're not getting flexion, then we always do recommend physio, and it really is up to the consultant you see, and that's a conversation you can have with him about how much physio he recommends for you. Dorothy, do you have to self-isolate before surgery? So you have to self-isolate. So we do the COVID test. We'll talk about the COVID test. Is done 72 to 48 hours before your surgery. And we do recommend that you isolate from the time you've had the test to the time you come down. And also, a lot of people are now getting their tests done closer to home rather than coming back down here for them. And that's a question you can ask once you've been seen and you decide that you'd rather not travel back down again 3 days before surgery, and you can get your test done as long as it's 72 to 48 hours before, and as long as you have your results when you come in for admission, and we will take it off the cost as well. You just need to let Glenda know that you've had that done externally. Can pre-assessment be booked if verbal confirmation has been given of approval?
Verbal confirmation.
I don't know anyone that's but look, I think that I can still book. We can book the pre-assessment and appointment if the forms have gone in and but we won't book it for about 5 weeks time anyway.
You just have to have the approval before you have the actual surgery.
Yeah. So we're happy to do that. But what I do say to people is we won't book it before you've actually filled in the forms, because a lot of people have found then they're having terrible problems getting the letter that they're on the waiting list, and that already they've already made appointments and then they're not able to make them because they haven't actually been able to get the form in. So once the form is submitted and you're waiting for the approval to come back, we're happy to take the call and make the appointment. Ruth, are many people turned down, and if so, why? Now,
I haven't heard of anyone being
we've
turned
been
down.
doing this, for 8 years, I think, the cross border, and I haven't known one person
Once
to be
you're on
turned
the
down.
NHS waiting list, there's no complication.
Yeah. Okay.
Query,
Ruth,
Fiona, maybe you take that query. How long? So Ruth, she needs both knees replaced. If they're separate surgeries, how long is recommended between the two surgeries?
Given that I only have a 9-month window. Okay. So usually what the consultants do, if you don't want to have them done bilaterally, the time would be, most consultants do them 6 to 8 weeks, say 6 to 8 weeks. Especially knees, there's a lot more work entailed in a knee replacement, so I'd probably be looking more at 8 weeks rather than 6 weeks. It is up to your individual surgeon, but I think 8 weeks is probably one that most of them would recommend. And it also depends how well you've done from the first one. So, you take all those things into account. Mavis, can we discuss having both knees done at the assessment at 78? Am I too old for this? No, Mavis, it's something that you can discuss at the assessment. Not all surgeons do them, but it's definitely something to discuss with your consultant to see if you're suitable. And at 78, you're not too old. I think we did an 89-year-old recently who had both knees and he's done very well. So no, you're still young.
Mavis, you're only a spring chicken.
Okay. Daryl, if you need more physio, is it organised back in Northern Ireland? Now, Daryl, it does depend on what surgery you have done, but it is your GP that normally organises that for you. And it is in Northern Ireland because it's probably too far to be travelling up and down for physio. But it also does, again, depend on what surgery you're having done. John, if there are any emergency complications after you're at home, will the NHS take over? Okay, John, if you got very sick at home, they would take over. Now, if it was a complication to do with surgery, as we said, there's no, the consultants here prefer that you would come back. It's very rare that it happens, but if there's anything, it's a complication of surgery and you're fit and able to travel, that's the main thing, then we would bring you back here. Other than that, the NHS will take over. Sometimes people may get swelling in their leg, they think maybe they've had a clot or something, and they go straight into the NHS and they'll scan their leg, straight away. There isn't any problems there. It's only things that are very particular that maybe, and your GP would also probably tell you to come back if he was concerned. But if it's an emergency, the NHS will definitely take over. And
can I just mention there, John, if you're readmitted within 30 days of discharge, there won't be a fee.
No.
You come back in after 30 days.
Okay. Okay. David Heron, do you do laminectomy for spinal canal stenosis? Now, David, we do laminectomies here with all the spines, especially the spinals. Anyone's got spinal surgery, they need to have done. The consultants would all want to see your letter of referral, and that's the letter you need to prove that you're on the waiting list before they'd agree to do any spinal surgery. So what I would suggest, if anyone is waiting to have spinal surgery, just send a letter into Rebecca or myself, and then one of us will give it to one of the spinal surgeons to look at to just agree. And then Glenda can price that up, because it's not as easy to price for spines as it is just for plain hip and knee replacement. So there's a lot more operations. Same with the shoulder and the foot and ankle. They're not as easy to price. So there's a lot of different codes, different types of surgery
levels as well.
So we do like to get letters from those, and then we can ask our consultants to give us the codes for them, and then we can price them up for you so that you're getting the right cost. Yvonne, once you have approval, do you have 9 months past July 22nd to have surgery, or does it have to be completed? Okay, Yvonne, so if you put your application in, say in May, you should still have 9 months to get your surgery done. That's as far as we're aware, that once you've got approval, you have 9 months to get that surgery done within that approval time. So you should be covered. But once you get your approval, they would tell you that anyway. Adrian, do you need to have a letter from the NHS confirming that you're on the waiting list, or verbal written confirmation? No, you have to. The one thing you have to have is a letter. So that letter, when you have the application form, I've got the application form here, they ask you for evidence that you are on a waiting list. So whatever happens, you have to add that letter to the application form. Like I said, your GP should have that letter, or the consultant that you saw. So yeah, but they won't take anything. And a lot of people get confused because they say, no, my GP sent a letter to put me on the list, but they've actually only sent a letter to put them on the list to see a consultant for the first time. The consultant then has to put them on the surgical list. So just make sure that you're on an actual surgical list with a hospital in Northern Ireland. So Rose, I'm waiting on approval as I posted the form 4 weeks ago. Can I book a surgeon yet, or do I need the evidence of approval first? No, Rose, look, you can get in touch with us and we can actually start that process for you. So Fiona asked me how successful is a knee replacement and how many are completed within the last month. Now, Fiona, I think when you were listening to Gavin's talk, he probably would have explained that the knee replacement, you know, you're looking at 12 months of like hard work to get the knee back. And, you know, that I think he spoke to, and everybody is different as well with that. So I think that's something you have to discuss with your surgeon. And how many have we completed within the last month? I can't tell you the last month, but we do about 1,000 a year. So we do about 1,000 knee replacements a year, which is quite a lot. We're probably one of the highest hospitals in the country for knee replacements and hip replacements. I hope that answers your question. But look, if you want to, we can always give you a call if you send us your number or email, and I can talk to you a bit more about that.
Just want to know what's the cost of a private room. All the prices that we quote are for semi-private rooms. In our semi-private rooms, there's only 2 beds. The reason we don't actually offer the private room is because our insured patients, a lot of our insured patients would actually have to come for the private room. If you wish to take private room, let's say for hip or knee replacements, the difference in cost would be about €1,000. But again, if you want to hit the finance tab and put that query through to me, I can let you know what the semi-private rate is and private rate. But approximately €1,000 would be the difference in a private room.
Janice said, hi, just wondering if it's means tested to determine which percentage is refunded. Actually, Janice, no, I think whatever happens, there's a standard price. So if what they give you, say they give you 8,000 for a hip replacement, that's what you get. So it doesn't matter if you go to somewhere where the hip replacement is 14,000 or 12,000 or 10,000, they still give you the same amount. So if they don't means test it, there's a set price, and that's the standard price. It doesn't matter where you go and there's no means testing at all on that. Gordon, who would supply specialist seating, etc. for aftercare for hip replacement? Okay, Gordon, so when you have your hip replacement here, so you will need a high toilet seat and things, and that's included, and you get that when you go home. Anything else, if you need anything else at home, say you want to get a seat in or other equipment, then you would need to go through the community for that, and occupational therapist on the community for that. Now, those kind of things, sometimes you can't request until you're actually a patient in the hospital, but anything like that, convalescence, special care packages at home, you just need to let us know. You let me know if you need any of those things beforehand. And when you're having your pre-assessment, that's a good time to talk about things that you might need afterwards, any care that you might need at home, especially if you live on your own. So that's the time to talk to pre-assessment about it. They usually then let me know, and I just get in contact with the different trusts on that one.
If you want to take Anne McKay,
you can take that
I
one.
want to know, do all the surgeons vary in package prices? And the answer to that is no, they all charge the same because we have an agreement with all our surgeons. All our surgeons are on board with us in price. So it doesn't matter which surgeon you go to for your hip or your knee, the price will be exactly the same.
Maureen, yeah, Maureen, you're asking there again about the letter from the NHS consultant to the GP saying it's put you on the waiting list. That is actually sufficient. Yeah, as long as that letter is from your NHS consultant to your GP saying it's put you on the waiting list, that's exactly the proof that you need. And every GP should have a copy of that letter. So I think someone else has asked the question there. Do you want to just move that one over? Yeah. Jean Chambers, can you tell us any more about the methods for using the scheme while waiting on the waiting list for the official consultant's referral. Yeah, Jean, I think that's probably, you could probably go and see somebody privately as long as they have a waiting list or in one of the public hospitals. But I'm happy if you want to send in your email and contact the team, and we'll give you a bit more information on that one. I think that's all the questions now. So listen, thanks so much for joining us tonight, and thanks Linda and Gavin for contributing. So thank you for joining us, and good night.
Thank you.